Myxedema coma. Myxedema coma is a rare but life-threatening complication of hypothyroidism. So, when a patient has persistent hypothyroidism and there is a stressor, for example, an acute illness, a surgery, administration of sedatives, etc., or even rapid discontinuation of thyroid medication, that puts your body into added stress. So if you already have hypothyroidism and then you have a stressor, that increases the risk of developing myxedema coma. Myxedema coma is characterized by all those signs and symptoms that you can see in hypothyroidism, but in addition, you would also notice a person can go into a respiratory failure and subsequent coma. So let us quickly look at what are the signs and symptoms of hypothyroidism which are common with myxedema coma. The signs and symptoms include hypotension, hypothermia, hypoglycemia, hyponatremia, bradycardia. These symptoms are common with hypothyroidism. In addition to these, the patient can also develop respiratory failure and coma. Now coming to the management of myxedema coma. First of all, treat the cause. If there is an acute infection, treat. If the person has discontinued the thyroid medication, restart those. So treatment is basically treating the cause. But nursing interventions are a little bit different. We all know that when we come to nursing intervention, you have to go by airway, breathing, circulation, and neuro. In airway, because this patient is at a risk of going into coma, it's very, very important that we maintain patent airway. How are we going to maintain a patent airway? You have to make sure that you have adequate supplies at the bedside to maintain a patent airway. In addition, the management includes symptom management. So you have hypothermia. Make sure you're providing the patient with warm blankets and you're checking the temperatures every hour or frequent, depending on the condition. You have hyponatremia, replace the sodium. Hypotension, administer IV fluids. Hypoglycemia, make sure that the sugar levels are maintained by providing IV fluids or glucose by IV. In conclusion, when we are looking at myxedema coma, always remember that a patient who has persistent hypothyroidism is at a risk of developing myxedema coma when there is an additional stressor added to the general patient. The additional stressor could be anything ranging from stopping your medication to an acute infection or a post-op. You have all those signs and symptoms the same as hypothyroidism. In addition, the patient might develop respiratory failure that leads to coma. Management again is symptom management. You look at the symptom and treat accordingly. Always make sure that your airway patency is maintained and you are making sure that aspiration precaution interventions are in place. In addition, check SpO2 frequently to make sure that the oxygenation is maintained, and if you notice hypoxia, replace oxygen. Education is also very, very important. Once a patient comes out of myxedema coma, it's very, very important to educate them on the importance of compliance to the treatment or therapy that has been initiated for hypothyroidism.